On behalf of the University of California, San Francisco Alumni Relations Team, welcome to our webinar titled How I Became. Before we begin, please take note of a few housekeeping items. This webinar is being recorded, and all microphones besides our panelists have been muted. Please utilize the Q&A box to ask questions. We will attempt to answer as many questions as possible during the last 10 to 15 minutes of the webinar. I'm your host, John McCoy, one of the directors of Alumni Relations at UCSF. And joining me today are our co-hosts, Jacqueline Carrillo, Recruitment and Retention Committee Chair for UCSF Associate Students of the School of Nursing, Mitchell Cole, Public Affairs Officer for the UCSF Associate Students of the Graduate Division, and Sarah Williams, PhD candidate in Chemistry and Chemical Biology, Vice President of Internal Affairs, UCSF Graduate and Professional Student Association. Our alumni guest today is Dr. Daniel Linnen. Dr. Daniel Linnen is the Program Director of Research and Data Science at the Northern California Regional Offices of Kaiser Permanente. He's responsible for advancing the regional research program for 21 hospitals. He also serves as a scientific reviewer on the Kaiser Permanente Northern California IRB and received appointments as Section Chief for Clinical Operations of COVID-19 Regional Command Center and Interim Regional Analytics Lead for the Patient Care Services Division. Dr. Linnen earned his PhD in Quantitative Health Services Research and his MS in Health Systems Leadership from UCSF. Welcome, Dr. Linnen.
Yeah, thank you. So honored to be here.
Thank you. So our first question, just to help get us started, is how do you describe to others the work that you do, and why you do it, and what do you enjoy about it?
Yeah, so thank you again. My role is, after I graduated with my PhD from the School of Nursing, I moved into this role that I currently have at Kaiser in Northern California, which is the Program Director of Nursing Research and Data Science. And what that basically means is that I'm responsible for the entire region's patient care services research strategy. So that's 21 hospitals, and also partnerships that are outside of the health plan side and actually moving into the physician part as well. As you can imagine, Kaiser is huge, very large corporation with many different entities. So part of my role, reporting to the director, of course, is to basically keep that all as straight as possible.
Thank you for that.
Yeah, very cool. So Daniel, it seems like in your professional career, you've engaged with a number of different verticals, things like healthcare services, health system leadership, clinical operations, data science. What experiences led you to kind of end up where you are at now?
Yeah, thanks. I mean, this is a great question because so I'm in my mid-40s now. I have two kids. I'm actually from Germany. I immigrated here about 20 years ago. From Berlin in Germany, and basically lived my life over there. Went to nursing school in Germany. Didn't have the best upbringing. It was pretty traumatic background I'm coming from, but I'm here now with my wife from California and super happy. And so I have a little bit of a journey coming here. Initially for 10 years I worked in critical care at Kaiser. Here in the Bay Area. Essentially, my entire career has been at Kaiser Permanente since I came here. So, and basically was really fascinated by informatics initially. So when we were in critical care, in my leadership role, we rolled out our electronic health record back almost 10, 15 years ago, I want to say. And I was really fascinated by that system. And so I got more involved in informatics. And you know, that's kind of a thread I have anyway, that I'm really curious, and I'm interested in how the things work behind the scenes, you know, behind the curtain. and and so I got my master's at UCSF, also got a bachelor's at Chico State, you know, because basically my German training didn't count, academically speaking. So I basically have 2 nursing degrees, did it twice. Got my master's then here at UCSF in 2013 in health systems leadership, and really started seeing more of the big picture, which I really enjoy. Still to this day, is really probably the one thing that I love doing in my current role, is that you have really this, you know, bird's eye view of things, and that's what I'm naturally drawn to. Yeah, so I worked in informatics in the national IT role, and then was bit by the data science bug and the predictive analytics bug, and really interested in, you know, how can we make use of all this massive amount of data that we're sitting on, you know, because our EHRs are collecting data like crazy, but what are we actually doing with that, you know, in terms of, you know, improving the system, improving care. And that's why I went back to UCSF for my PhD. And I was very fortunate that I was able to work in the division of research at Kaiser Permanente. So that was basically a courtesy appointment that I had there while I was a PhD student in the School of Nursing. And we did, you know, exactly what I said. It's like large scale health systems leadership type analyses, you know, on a variety of outcomes. Some of them were award winning as well. And then based on that momentum, based on that work, I moved into my current role, which really is 80% at least leadership, administrative. Not a lot of research that I'm able to conduct on my own right now.
That's really impressive. I can't imagine going through nursing school twice. But I can see how that gave you enough perspective to really want to pursue looking at the behind the scenes. There's just so much that we see as nurses. So what types of opportunities are on the horizon for students, professionals who may want to follow in your footsteps?
Yeah, so I mean, we're really living in a fast-moving world, you know, but I also look at everything and kind of sometimes think that we are going in big circles, you know, and we're coming back to the same kind of take-home messages in the health policy world, you know, in the big data tech world. So there's certainly a lot of activity and innovation going on in the tech field around health and mobile. And also, you know, with Google, for example, and predictive analytics, and moving into, you know, really quite advanced quantitative systems, you know, and reinforcement machine learning, deep learning, that kind of thing, which can be really interesting. But you do have to have a little bit of training and preparation to really be, you know, able to be relevant in that field, especially if you are coming from it more from a clinical side. Like my background is, you know, clinical and operational. I learned coding on the side basically while I was in my program here at UCSF, and coding in R primarily and Stata. And so that helped me understand the space, and also actually be able to program my own code is really important if you want to work with engineers on anything. So those, I mean, that's where I'm coming from basically, is this tech angle. You know, I think that's definitely up and coming.
Yeah, I can see just being in the Bay Area, right? We're exposed to so much tech. We're kind of in that like space of technology and engineering. Were there any particular experiences during your time at UCSF or another institution that made a difference in how your career unfolded?
Yeah, so UCSF was super instrumental in my development and my interests, being able to further my interests in programming and coding and the whole quantitative advanced analytics stuff, you know. So one thing that definitely comes to mind is the software carpentry workshops. that were completely free, that were offered through the UCSF library. There basically are boot camps. I think they're also in other languages as well. And I took 2 of those. They're, boot camps, so they're over several days, and you really learn kind of coding in that language from A to Z, which is a super nice introductory way of learning a new language. So that was something I did. I also had 2 opportunities through the School of Nursing. One was NIH-funded week-long intensive in New York City that I was fortunate enough to be selected for, called Big Data for Medicine, or Big Data Coursework for Medicine. And I also had a travel to the NIH itself in Bethesda, in Maryland, actually. And it is Bethesda, I think, right? And was on the campus there for a week, intensive in precision health. So I learned that as well. And I thought so that really helped with the understanding the larger landscape, the policy landscape, but also how the players interact in the precision health realm. And the data science intensive in New York was, really important because it talked in much depth with like true experts, national, international experts on where the field is going. So yeah, those were definitely very important moments for me in my training.
Yeah, that's super cool. It seems like you were able to take advantage of a lot of variety of different educational opportunities.
Yeah, I also tried to get into the machine learning course at Berkeley, at Cal, and they were waitlisted, so I was not fortunate enough to get into that. So you have to kind of push on a variety of fronts, would be my advice here to the group in general, because there's just a lot of activity all the time, and opportunities, a lot of people trying to go for the same opportunities, so try to diversify.
Yeah, so I guess building off of that, if you could go back to your time at UCSF or any other institution that you've attended, are there things that you would do differently, approaches you would take now that maybe you didn't think of then?
That's a good question. So I pushed through in 3 years. That was primarily driven economically. So, I already had 2 degrees I had to pay off at that time. I have 2 children, my wife and I live in the Bay Area, which has a crazy cost of living. So I was very determined to get through my PhD in 3 years, which I did successfully. But there were definitely opportunities I left by the wayside, so to your point. But that was really clear to me. And, like one thing that I would have loved to do, for example, would be more involved in the actual deep learning space at UCSF, which, there's an entire BACAR Institute of Computational Health Sciences that I wasn't able to interact with at all. And that was just the choice, basically, that I made at the time.
Daniel, you talked a lot about diversifying during your student experience. I guess during that time period as a student, why was that important to you to kind of diversify, to experience this boot camp piece while also doing your program? What was happening around you what do you want for your future that you thought that would be impactful for you?
Yeah, so what I'm trying to get to there was more around sniffing things out, basically. It sounds a little, yeah, but it really is that for me. Trying to relatively quickly understand what works and doesn't work for you. So it might just be what your personality type is, even, or what you're naturally drawn to, So, for example, I'm more of a specialist type, like a very methodical, I like to go deep, not, long, if that makes any sense. But some people might be more true generalists, so they enjoy that variety in that sense. So I don't really enjoy variety that much. But I need to understand what I'm after, so that's what I was trying to explain there. And then the other diversity part is just, or diversification part is, you have to assume that 10% of your shots work out, right, when you apply for things. So like part of it is just the nature of being in a competitive field.
And then as a follow-up to that, and somewhat related, but you mentioned now in your career you are 80% health leadership and not so much clinical. Is that something that you miss, or that you wish you could integrate more of, or was that kind of how you planned and wanted things to work out?
Yeah, I think it's a little bit of both. I mean, it's when I was looking for what's next after graduation, I basically was dealing with constraints or reality, and one reality was that I have children, I also have other family that needed me and my wife locally. So we didn't have really the option of moving anywhere, B, we had income constraints. We had to make a certain amount of money, which also negated a bunch of opportunities, and then third, it was more around purpose, so I knew that I wanted to do something that was, like I described, like this high level leadership approach, where I was also able to work analytically, or at least produce new insights, answer important questions. They may not be research questions, because obviously in business, things are a lot more pragmatic than they can be in science, and faster moving as well. So that is definitely a trade-off. And then you also have the time, right? Like if you have the time to look for the perfect opportunity for a year, that's great. But most of us, have to figure things out, and so my transition into my current role was an absolute natural fit. It was actually a big honor for my organization to say, we see you and your accomplishments and your awards and your drive, and we're offering you this, because this was an inaugural role. I mean, like that the role didn't exist before I took it, so in that sense, yeah, nobody gets everything they want, right? And so what I'm probably the saddest about is that I can't conduct my own research and can't really spend a lot of time building my own program of research, which I would have loved to do, so I think, in terms of people thinking about their next step, I think, if you are leaving academia, then, that definitely comes at that price, for many of us, I think.
Hi, Daniel. This is Mitchell.
Hey.
So yeah, it seems like there are a lot of constraints on an already intense training path. Can you talk a little bit about the people who mentored you and helped you along the way to go from a data science boot camp to full-on director of research and data science?
Yeah, so I had you do need mentors. That's actually a great point in general. My mentor was Dr. Gabriel Escobar at Kaiser, who is a nationally renowned expert in early warning systems and basically predictive analytics. And then on the UCSF side, I was very fortunate to work with Xiao Hu and Caroline Stevens. Xiao Hu had was part of faculty at UC Berkeley and UCSF in machine learning. He's actually a computer engineer by trade, a PhD professor. And then my main dissertation chair and mentor and advisor was Caroline Stevens, who's just an outstanding faculty. I mean, just smart as can be, and just really, really amazing mentor. And they were also really helpful in understanding constraints. I mean, to your point, so you really have to know what you want. I mean, Caroline would have loved for me to go for a postdoc and have a more traditional academic career, but like I said, I mean, economically speaking, that was not realistic for me, you know. And yeah, I mean, don't get too impressed by my title. You know what I mean? It's all very much a team sport at Kaiser. It's a huge organization. You know, we have 21 hospitals. They're all running their own show. So it's more about coordination and orchestration. You know, it's not so much running anything yourself. You know, it's more the ability to work with and through people.
Yeah, as you've stepped sort of into more of this leadership role, have you found that you yourself have the opportunity to do a lot of mentorship work or to, you know, coach people who are on this similar path that you're on? And what's your
Yeah.
experience with that been like?
Yeah, I did have a few folks now that I mentored, and I'm also constantly consulting with students. So those aren't really mentorship, you know, situations. It's more about showing them how to navigate the path correctly. But I did have a few mentorship opportunities as well, and one I'm particularly happy about and proud of is a data scientist who worked with me for 2 years, and I learned as much from him in the end as he learned from me, because he came purely from the data computer IT side, didn't really have, you know, big picture thinking at that time, and also certainly not the healthcare background. So I was able to show him that world, and that's really important if you want to be in data science anyway. Is you got to understand the business reality that you're trying to work in and the questions you're trying to answer. You know, because for him, initially everything was a machine learning problem, and it certainly isn't. You know, like it's just not. That's not what we're talking about. If descriptive statistics can answer the question, then that's all you need. You know, like it doesn't have to be more complicated than that. So that's certainly a mentorship that I enjoyed a lot. And I was sad to see him leave. He went to Stanford actually after everything. So I'm like, you know, I would have loved for him to stick around, but yeah. So that's probably my number one mentee I would bring up here.
Taking advantage of having you right now, by asking you a mentoring type question, do you know of any industries that we could tap into that would make an impact on healthcare as it is now, like new and upcoming things from your perspective?
Yeah, so my angle is certainly, you know, more on the tech side and EHRs, data science, that kind of world. And I did have opportunities to attend some conferences over the years and kind of get a pretty good sense of how the market and the industry is behaving and what they're after. So I would say that right now, what's really happening is you know, digital health. There's a lot around wellness and emotional wellness and you know, things like self-management. I think there, you know, I want to say 5 to 10 years ago, we were really wild about sensors, you know, like like Apple Watches and what have you. But that field is still happening, but I don't hear as much, you know, in that space necessarily. But you know, don't make any. I mean, it's really tech, right? So what the number one takeaway from tech is that I have is as a clinician, you know, is that it's about monetization. So the attitude towards, you know, the product is much more business driven and shareholder interest driven than, you know, when you're coming at it from a true kind of informaticist angle, clinician angle, right, where you understand the reality of a patient. That's kind of more of a side note, I think, for the majority of the industry stuff that I'm seeing.
When you were talking earlier about the mentee that you worked with and getting him or her to kind of think big picture, it makes me think about, you know, so this program that How I Became is something that we invite all students, regardless of their the school at UCSF that they come from to be a part of. And so maybe you can talk more about, beyond the technical or scientific skill set that you may need as a nurse or an MD or a bioengineer, how do you go about developing those? I think of them as soft skills, or work.
Yeah.
What's the advice to current students about getting outside the lab and developing those skills, and where should they look, and how did you play around with that when you were a student and after?
Yeah, yeah, you guys have to really figure this out on your own, I think. I mean, it really boils down to your personality type too. So what doesn't work for me, for example, I'm an introvert, and I don't enjoy meeting 1,000 people, and then I have to take a year off to digest all of that information, So, I mean, I'm joking, but so for me, it's a little bit more selective. I'm trying to be like, I try to see, the path ahead of me, and then I'm trying to understand a couple of key people that I might want to have an informational interview with. And I've had quite a few along. I would really encourage anybody to go for informational interviews for sure, even if they don't work out. It's still a good learning experience. So I've had, and across the disciplines, John, to your point, I mean, seek out, other disciplines, whoever they may be. So I've had meetings at UCSF with physician leaders in informatics and data science, and they were super helpful in guiding, and giving ideas. And so, yeah, that's definitely, and that's time well spent, because that's like a really intensive, maybe 30 minutes you have with somebody that can really open up your horizon. And other people who are more extroverted, they may enjoy, a completely different approach. So you really have to figure out what makes sense for you. Conferences, that's another great way of doing it. But to me, like I said, I mean, I find that a little exhausting. I'm not a big conference guy. I would cherry pick maybe the top 3 events of the day and call it a day. So.
I definitely understand it. I just want to say that I identify as an introvert also, so you're not alone. And I practice some of the things that
I think it's about 50% of the population. So
yeah.
Are there any other alternative careers that you would consider if you weren't working at Kaiser, Daniel?
Yeah, I mean, I would certainly, my big passion remains data science and machine learning and AI, and like I said, you can't have it all. I'm very happy in my role right now. And I think that, a company as big as Kaiser, I think most of you know this, but Kaiser is, all over the United States. We have 8 regions, we have like 35 hospitals across the US. 21 in Northern California alone, like $89 billion annual revenue. It's just a very big company. And so, it's a big honor to be asked, to lead one big aspect of it for my profession, so always got to be mindful of that opportunity and what it means. But also, there is obviously an entire other stream of data science and AI happening, and that's also beyond health, of course, right? And we're also just at the cusp now where, the next generation of computing will be quantum computing, which will be insanely capable, will basically rewrite computing as we know it. It'll be so incredibly fast and capable, like I think we won't even understand it until we start seeing that. But even before that, like right now, there's certainly huge advancements being made in computing. Cal is absolutely leading, in the world in data science. Just their entire engineering department alone is just, amazing and awesome. So that would be my field, I guess, is what I'm trying to get to in terms of answering your question, But I don't have any intent of going anywhere. So.
We also, so in your bio, it mentions that you were given the title or the assigned section chief for clinical operations for, is it the COVID-19 Regional Command Center? So, what from that experience, what are your thoughts on the pandemic, and were there particular lessons learned, researched, or experiences that you gathered from that? Can you just share more about what that was like for you?
Yeah, I'm trying to forget the pandemic as much as I can. So, yeah, we've all suffered through an unpleasant pandemic. Clinicians at the front line more than anybody else. The work that so that's basically on the side while I'm doing my day job, is to also support the command center some days of the week. And it's just so Kaiser, I mean, think of it like a tree. So you have a stem, and then you have branches and smaller branches coming out of those branches, and then you have leaves, so that's kind of the system we're talking about. So at the regional command center, we're really quite removed from the frontline activity, so it's more about the big ticket questions, like the really, let's say, burning issues of the day. And we're doing that again in partnership with everybody else, so we have the physician group, we have continuum of care, employee health, I mean, on and on and on and on. Yeah, so I mean, it definitely was a huge undertaking for Kaiser to manage the COVID pandemic the way it did, and I'm extremely proud of my organization, with all, I don't know, 10 million people that we're insuring. But I think it's 12 million people across the US and like 4+ million in Northern California. I mean, just think about having to manage 4 million members, so really, really amazing to be part of that work.
Yeah, I can see why you mentioned that it's a shame that you can't engage in some research. Just having that amount of data at your fingertips just sounds incredibly tempting. I am interested in how you narrowed your focus. There's just so many interesting things that you've talked about, and you could have gone in so many directions, but for most of us students, we kind of hit that point where we hear everything we hear about we want to do. How do you narrow your focus?
Yeah, so 46 years old, I think I arrived where I arrived because I learned over time what works and doesn't work for me, so I think it's not so much about what you do, to be honest with you. I mean, you have your constraints that will basically tell you what is beyond what you can reach, so that's off the table or whatever. But within what is in reach, like, I think the number one thing is, like, who are you actually working with? The people. It's not what you do, like, I mean, you can do any number of things and they can be, exciting and invigorating, but it doesn't really matter if, you're reporting to somebody you don't enjoy reporting to, or if you're really bad off, then you're in a toxic environment. Who cares if that's the most amazing project ever if you don't enjoy the people, so I think that would be my number one consideration from here on out in my career, and I still have 20 years to go, and like, who am I working with more than anything?
Yeah, you've talked to us a lot about learning to work within the constraints of business and the business world. Do you have any advice for students coming out of graduate programs or professional degrees on how to navigate the business world stepping out for the first time?
Yeah, well, I think that we all, are suffering from imposter syndrome to some degree. I mean, I certainly have, and so I can feel that if you're moving outside of your comfort zone, that can feel daunting. But from my experience, there are so many transferable skills that you're actually probably a really good candidate for a large number of roles. And also, to be honest with you, coming from academia, many people look up at you for that, so it's not like really a bad thing. Even if you're lacking some specific skills, I think a lot of it is about being able to communicate the transferability of your skill set, like the skill set that you do have, and that you understand how that may be of benefit to a business, So like I said, a project will move a lot faster than you would be used to in a research setting or a lab setting, the funding situation too is very different. So, like it's just going to be a different animal, but the skills you're using are the same, So like, I mean, what am I talking about? I'm talking about, soft skills that John mentioned, people skills, being able to collaborate, being, willing to negotiate, also understand what you're not willing to give up, in that negotiation. That's important too. Like you need to know what you need, and then, it's just really about not giving up, I think, so so in my example, when I moved, before I transferred into this role here at Kaiser, there were other job opportunities that were starting to line up for me, and what I did notice is those were all in tech, like they were tech related, data science related type opportunities, and what I did notice was there was a little bit of ageism, that seemed to be going on, so even just being in my mid 40s, I mean, they were tech bros. I mean, excuse me, I'm being flippant here, but they were 20-something-year-olds. They were hiring, and I certainly wasn't fitting that mold, So there's nothing you can do about that. Like, you're 46, you're 46, But generally speaking, I think if you just keep at it, and you're really, kind of, you understand what business needs, and you're willing to make concessions in terms of the realities that that they have, you should be fine.
Thank you for that, Daniel. I just think that's a great, reminds me of what you said earlier about the role of informational interviews, because I think about that's probably an opportunity to, if you're struggling for struggling to on the right verbiage or words to use in talking about how your skills transfer over to another area, maybe that's a informational interview with someone that you trust or who are just exploring another career or another program, and asking soft questions about it could be helpful in finding that language to use.
Yeah. No, and also, like I said, conferences are really good at scoping out, like, do you feel out if that even is something that you could imagine yourself doing, so so for example, for me, doing predictive analytics for Levi's, the jeans company, or another company, just to monetize data for ad profit, that was a turnoff. I was not enjoying that prospect, and I learned that because I attended a conference, because that's all they talked about all day long is monetizing data for profit, and they were happy to do it. So, you just have to kind of show up and understand, what they're about, basically. So for me, I'm doing data science. I'm interested in that because of the patient, like the actual outcome, the benefit that is associated with, a tool like a predictive analytics tool, not the money part, so.
In the time we have left, might you be able to share with us probably a data science project that you've worked on in the past or you're currently working on with Kaiser, and its outcomes, or what it's driving on behalf of the patients?
Yeah, so I mean, it's proprietary, so I'm trying to think about something. Well, one thing I did that isn't proprietary, that wasn't couple of years ago was the AHRQ Data Science Challenge that I did with my mentee that I mentioned earlier, actually. So this one I can talk about easily. It's basically, AHRQ is the Agency for Healthcare Research and Quality, and they basically put on a data science prediction challenge, which was very much in my ballpark, was basically county level prediction of hospital utilization. So basically how many patients were, discharged, for example. And they wanted to create a model that would predict that with, the highest possible accuracy. And that was a national, if not international, challenge. And we built a predictive model. So I did 50% of the coding for that, including all the data management, getting the data in, managing it, transforming data, as you have to, almost always have to do a lot of upfront work. So I did most of that. And then we built basically different machine learning models. So random forest, gradient boosted machines, just linear models for comparison. So these were all supervised machine learning models, nothing super crazy fancy, So we didn't use any GPUs or anything, for this part. And actually came up with some really interesting features. So basically predictors of hospital utilization, which were, that's to me really what I love so much about this work, is that you're sitting just on a pile of raw data. It's way too much to make any sense of it, and you start analyzing it to a point where you're filtering out the nuggets, and then after you go beyond the nuggets even, and then you actually get real gold, like an actual insight, that is hiding in all of that crazy chaos, And it's good to remember that, I have I went through the ticker program at the School of Medicine and Biostatistics, and so it's really important to remember that a lot of this is based on traditional statistics too, and they have been around for, many years. And so the general notion, let's say, of finding, predictors of outcome X isn't really anything new. What is new, these days is that we have increasingly capable machine learning models that are, that kind of go beyond the traditional, logistic regression or, whatever multivariable regression. And they can basically find clusters or patterns, in different ways. But at the end of all of it, you're coming up with just a few predictors that are meaningful, which I always find super interesting, because you have this entire, haystack, and then you find that one, needle, So, and then other work I have done is, like I said earlier too, I have a pretty advanced skill set, and I have, I'm lucky enough to have some awards for this work too. But, I'm also quite content providing decent summary statistics to describe to business executives in clear language what the heck's actually going on, for a given question. So I can't really talk about what specifically I may be asked to do, but my point is that if you can just provide clear, clean answers and insights, analytics, it doesn't always have to be, crazy advanced stuff. Often what really matters to executives is that you give them something they can actually, use and do something with, right?
Thank you for that, Daniel. In the time that we have left, are there any questions that we didn't ask that you thought that we would ask? Or if not, then are there any insights from your career that you will like the students to definitely receive and hear?
Yeah, I would go back to the constraints, because that to me was really helpful, and somebody else pointed this out to me too. So, time is your number one constraint. Like, how much time do you have to find your next, place? And then it's economics. it's location, are you willing or able to relocate? And then it's purpose, you know, so is this meeting the general gist of what you're about as a, you know, professional and or as a scientist? That would be my guidance more than anything. And then the second one obviously is mentors, you know, like in Germany, we call this vitamin R. You know, did you take your vitamin R for relationship? You know, so you get through the door probably because somebody is helping you in, you know, try to cultivate that relationship or those relationships if you can.
Great. Well, Daniel, thank you for your time today and for joining us. I want to also thank all of our co-hosts, Jacqueline, Sarah, and Mitchell. As a reminder to everyone, How I Became is a program from the Alumni Relations team. This is our last program for the current academic year. We will be bringing the program back next academic year. And if you're interested in participating, please do make sure to send a message to myself. My email address is very simple, it's john.mccoy@ucsf.edu, or just reach out to alumni@ucsf.edu. Once again, Dr. Daniel Linnen, thank you for your time and for speaking with us today. Have a nice afternoon, everyone.
Yes, thank you, everybody. Appreciate it.